Hi, everyone. We're just letting everybody file in before we start our webinar for TMJ. It'll just be a moment or two here. Thanks so much for coming in. Well, it's great to see you, Joanne, Edward, Donna. Perfect. Sean. Excellent. I think we'll get going and people will jump in on as we're getting started. Hi, Katie. Thank you very much. Good morning to you. If you guys have questions, just some housekeeping just before you get started in your chat. You can switch to all panelists or all panelists and attendees. That allows people to see your question or concerns if you have anything. So just go to your chat and switch to all panelists and attendees. That'd be great. If you do have a question, we encourage you. There's a Q&A button listed. You can pose your question there so it doesn't get lost necessarily in the chat. We certainly encourage everybody to give some feedback or any thoughts if you have anything going forward. But yeah, looks like everybody's in. We're going to start the presentation today. Let me share my screen here. Okay, so we're going to be talking about TMJ today, jaw pain, and we've got a couple of practitioners here who are familiar with TMJ and about the jaw, and we're going to have some introductions going on. So the first person that we have that's from Satori is Claire Yan. She's an osteopath. Claire, why don't you just give us a quick introduction?
Hi, yeah, so my name's Clara. I'm an osteopathic manual practitioner. I am at Satori 2 days a week. I do work a lot with clients who do have TMJ issues. If you're not too familiar with what an osteo does, we look not just at the symptom that you're coming in with, but we want to look at the whole body to see how things are pulling on certain areas and creating the pain that you're feeling. Certainly I do find that there are a lot of people who do have issues, headaches, neck pain that could be associated to TMJ. So I do believe that it is a very important joint to be looking at. So I hope that you guys can learn some stuff from today.
Super. The next person is the dentist who's just right above Satori, and that's Asena Akasoy. Take it away, Asena.
Good morning. Good morning, everybody. Thank you, Daryl, to give us the opportunity to reach out to everybody, especially these days. It's hard to communicate. I'm a general dentist in Momentum Dental. I am there 2 days a week. And as dentists, we are trained in TMJ and TMJ issues, the connective areas. So hopefully I can give you some information for everybody to understand the source of the problem. How can we treat, how can we help, and how you guys can help for yourselves. So let's see.
Super, thank you very much, Asena. My name is Daryl. If you don't know, I'm the owner of Satori Health and Wellness. I'm going to be your host today. I'm also a life coach there. So if there's any questions about mental wellness and whatnot, we can certainly have a chat offline. We're excited today to offer. I think, there's a sense here that what's going on here is that, some people know they have TMJ issues, but not fully understanding. And hopefully we can paint a little bit better picture about that. Because, from a couple of people that I've talked to the last day or so, TMJ is it's a serious issue, and it's got some people have been living with pain for a few years, and let's see what we can do to help them out. Just to give you a further sense here, Satori Health and Wellness, some people might not be aware, we're located at Eglinton and Avenue Road location right now, 418 Eglinton Avenue. There's a picture of where we're located. We've got massage therapy, osteopathy, life coaching, infrared sauna, and isometric training as well. Just above us is where Asena works, and that's the dentistry at Momentum Dental. I believe they have 2 or 3 dentists working there, yeah, in a bright new building. It's right on the ground floor. Anything else to add, Senna, about the momentum?
We have, like you said, full service dental, and everybody knows pretty well about what dentist does. So there's not much to explain. I wish I will say some other stuff to reduce the anxiety of dental treatment, but that is another topic. So we're there to help you all. Yeah.
That was a good, funny story where I was chatting with one of our Satori clients, and you walked by in the hallway, and just by meeting you, actually, they got compelled to actually make an appointment because they don't like seeing the dentist. They haven't seen one in 2 years, and so she booked an appointment. So just by meeting you for a minute makes a difference. It sounds good. Before we go to our first question, which is what is TMJ, we're going to put up our first poll here, talking about who's experiencing TMJ issues. So if you could take a look here and answer the first question, who's currently on the webinar experiencing TMJ issues? Plug in your question there, your answer, and let's see if what comes up. And if you have TMJ, go to the second question there. What's your pain level from 1 to 10, with 10 being the most severe here? And so it looks like right now, as it changing, look about 75% of people are experiencing TMJ issue on the current right now. Oh, yeah. So 69% said yes, they're having TMJ issues. 19% said no, and 3 people are saying what's TMJ. So good place to be here. In terms of the pain level, let's take a look here. Question 2. Has everybody answered? Anybody who's got pain? So it's wide variety actually here. So one person is saying that they're at level 9, one person level 7. So it's either 6 or below is the majority. So it's not I don't want to say it's manageable, but yeah, some level 6, less pain the better. So great job, guys. Thank you very much for answering that poll. Again, we're encouraging you to hit the Q&A if you have any questions, or type something in the chat. Oh, let's share the results here quickly. Oh, a lot of people are at level 1, so okay. So they got some interest here. So let's start off with our first question here is, what is TMJ here? Asena, do you want to lead us with this question?
Yeah, of course. Can we go to the next slide? So it is better to explain it with the photo. Perfect. All right. Daryl, I heard that if while you were asking the poll question, you said that who has TMJ. So that is the main problem that we are having while we're describing the TMJ. Okay, TMJ is temporomandibular joint. Everybody has that. Everyone. It is the joint that connecting your lower jaw on the photo on the right side to your skull, basically. And it is helping for your mouth to open and close, and sometimes moving side to side and forward and back. And yes, it is a joint, and it has been connected also with a lot of muscles. We can see on the left photo, we have temporalis muscle, masseter muscle, and some other muscles inside connected. And also, because it's a head and neck system, some of the neck muscles also being affected from this system. So our TMJ, temporomandibular joint, is working while we're talking, while we're chewing, while we're yawning, basically while we're doing anything with our jaw.
Super.
So
Claire,
that is TMJ.
go ahead. Claire, is there anything you wanted to add to that?
Nothing much. It's just one of the bigger discrepancies, I guess I can say, is a lot of people come in saying they've been diagnosed with TMJ, and I think that's what Asena was getting to, is that TMJ itself is not a diagnosis. TMJ pain is, so just don't be mistaken by that. Like she said, TMJ itself is a joint that everybody has on both sides of their face. And so that's just one big differential I just wanted to point out.
Okay, thank you. Our next question that, or part of our patient education here is what causes TMJ problems and what are the signs and symptoms here? Asena, did you want to take this question first?
Yeah. What causes TMJ problems? First of all, I would like to say this. Science exactly doesn't know what causes TMJ problems. And what we do about TMJ issues, it is we check everyone individually. So it can be stress, it can be a trauma to the joint, it can be arthritis, it can be a side effect of a medication, and many other stuff that we have to go through with our patients with their history. So it can be like misaligned teeth. We have some questions that we're gonna cover in the on the next slides at the end of the webinar. So many things may cause issues with the TMJ. And once our patient's having an issue around the jaw, that doesn't necessarily mean that it is exactly coming from the joint, because it's a big system, like you guys saw a little bit on those photos previous slide. It can be another areas that radiating towards that area or vice versa. And if we go to the signs and symptoms in a dental perspective, what we check is pain while you're opening your mouth, limitation. Some sounds are coming from your joint while you're opening, like popping or crispy sounds while we're opening our jaw fully. And you might feel discomfort while you're chewing some hard foods or like big bites. And headache, neck ache, ache on the frontal area around your eyebrows is also a sign and symptoms. What else? Sometimes in like advanced cases, patients may suffer from like pain while you're swallowing, pain radiating to the front of the jaw. Mm-hmm. And those are the things that right now I can say.
Okay.
So osteopathically, TMJ, what causes TMJ problems? Like I was saying, it could be there's a vast majority of reasons that could be causing it, stress being one of them, especially given what we're going through these days. A lot of people are feeling a lot of stress and anxiety and are creating these issues by clenching and grinding, possibly without knowing it. Posture has a lot to do with it. A lot of people are now working from home in a setup where you're not ergonomically set up like you would be at your actual workplace. And so a lot of people who have, maybe they're jutting their head a little bit more forward, that causes a lot of strain on the jaw as well, and that's going to create some issues. So osteopathically, there's some other things to look at, upper back and how you're breathing and how all of that is affected as well. Another sign and symptom that I would add to that is tension or pain and stiffness in the mornings in your jaw is a very big sign that you're clenching and grinding. And I know it was on the tip of your tongue, Asena. I was waiting for you to say it, and I know you've got a lot to say. So so that's one other sign and symptom that a lot of people, that's something to look out for. And you could be feeling that throughout the day as well. If you are clenching and grinding at your desk and you don't even know it, just look out for that. If you find that, if you all of a sudden can't take that big bite out of the burger that you used to be able to, that's another sign and symptom. It may not necessarily create pain, but you just all of a sudden can't do it and you've got some sort of locking mechanism there. That's another reason to seek out some treatment.
Good. Thank you so much. It just sounds like TMJ is not just focused on the jaw. It's kind of, you got to look at all the other aspects of the body, and maybe it's even nutrition or some of the environmental factors that might be, stress and anxiety. So it's good to hear about that. Our next question that we have here is, what is the treatment process? So Asena, you tell me about diagnosis, and explain a little bit more about that when a client comes to see you.
Alrighty. When a patient comes to us and complaining about a problem related to their jaw, we are looking at many factors, because it is, again, it is a big system, it is complicated system, and it has so many aspects on it. And what we are checking first is that if there is, like I said, is there, and Clara said, and any stiffness in the morning, any discomfort and headache in the morning once they woke up. Because if it's as a result of grinding or clenching the whole night long while we're sleeping, 6 hours, 8 hours, 4 or 5, your jaw is working, and it's a long time. And once you wake up, you feel like you chew some gums like whole night long. And you can feel it, that it is stiff, your face is tired, like you feel some heaviness on your face, on your jaw, everything. That is a good indication. And sometimes mouth opening is limited, right? And we are checking that. Why is that happening? Is it muscle related or is it joint related? We are checking the alignment of the teeth, if there is any imbalancement there in that department. And also, once the patient comes with the pain, we have to understand the source of the pain. Yes, we see patients coming with TMJ, but then we found out there is an infection somewhere. Maybe gums are inflamed, some teeth are infected, or because it is, again, a very complicated area and it's radiating so many areas, we can see ear pain, sinusitis, any other infections, arthritis can show as TMJ problem. So ruling out is the most important thing. And once we check and once we examine our patients, if we see another thing that complicated, we usually refer to family doctors, and so they can follow that medical road. If we don't see anything complicated in that position, what we usually recommend is night guard. As our patients know, it is occlusal splinting, actually. So you not necessarily need to wear it during the night. You can wear it anytime you feel straight. Also, relaxation techniques are very, very important. After all, yes, it's a joint, but it is surrounded by so many muscles that has been suffering from that problem. So relaxing the muscles, massage, also osteopath therapy is very, very important in that position, because once we have this problem, I see stiffness on the chewing muscles in the cheek. Sometimes we see that patients, one cheek is bigger than the other one because it was working. You know, it's like lifting heavy weights.
And you know what? One of the clients actually was talking about the dentist said they had a 6-pack on one of the sides.
Oh, wonderful. Yeah, that happens, which I do have it too, you know, and if you know, right now our participants, if they can check, you can find actually trigger points inside your muscle that some areas are more sore than the other. And once you clench, those muscles are popping. And we can see some trigger points in the temporal muscle over here. Sometimes we see patients are having like trigger points around the like upper brow. These are all muscle components. Also, again, in a dental perspective, we see some chipping enamel or flattened tooth surface all around the teeth. And that is also a result of a grinding. Can you imagine, like you're grinding, working on, like, and then everything is flattened. You know, we see that front teeth are not like, you know, different size anymore. They're all the same.
Well, yeah, look at my teeth. Yeah. So
yeah, it's fine.
I have to wear that night guard every night now. So
yeah, and also another sign that we check in our patient's mouth is the tongue and the cheeks. And while our patients are like grinding or clenching, we have a tendency to bite our cheeks. So what I take a look at if there is any wounds or any biting marks. And sometimes if you take a look in a mirror, there is a significant white line inside your cheek on both sides. If it's very prominent, you might be suffering from clenching. Also, our tongue is usually like one pink, very smooth edged organ, right? With the clenching or grinding, we see some scalloping around the tongue, like little bite marks. And it is a result of clenching. While you're clenching, you're also flattening your tongue on the floor of the mouth, and it is pressing all the way on your teeth, and then it is creating
That's
scalloping marks on your tongue.
Oh, interesting.
So if this problem only related to stress, anxiety, and it didn't proceed so much yet, what we do is I always focus on my patients' well-beings too, and stress management. Even sometimes I recommend meditation, breathing exercises, posture correction, as Clara said. And awareness is so important. So if you realize that you're clenching, just take a breath and just remind yourself that, okay, I need to relax my jaw. I do that all the time. I am suffering from this problem too. And it is the awareness. Everything starts with the awareness, even like asking for a treatment too.
Well, Senna, I like that when you're talking about the awareness. Once we bring that, then I'm guessing maybe that's half the game, where we can actually start to actually make a difference and change our habit onto that.
Yeah, it's an habit after all. Our brain, and it is a relaxing for our brain. Once you have pain, it is like Clara mentioned it before. It is like rubbing your muscle, and your brain is trying to cope with something while we're clenching, and try to focus on something else, and then it turns into a habit. This is the muscle. If it's teeth related, it is another story. If it's alignment, we can check orthodontics. If it's an infection, we can treat that. And again, if it's some other problem, we always refer to specialists.
Thank you very much, Asena.
No
Claire,
problem.
is there anything to add for your treatment process when someone comes in with a TMJ issue?
Yeah, for sure. Asena, that was really good. I don't know how many of you guys were there, like checking the inside of your cheeks, but I definitely was at that time. And I definitely clench and grind, and I thought I stopped, but I definitely have one of those ridges on one side of my cheek. So anyways, the treatment process osteopathically is a little bit different. Of course, we do look at the jaw as well, obviously not as in depth as looking to see, is there an abscess or anything. What I want to look at is the cranial system as a whole, the neck system, and moving further down. So when I say the cranial system as a whole, osteopathically, we work very subtly, very gently. And what I'm looking for is, where is there a lack of movement within your body? So every structure in your body has a movement to allow for blood flow, oxygen, nutrients, and everything to get processed and to push around your body. So everything has an expansion, retraction kind of movement. And once we lack that movement in one area, another area picks that up and has to take the brunt of the load. So when somebody comes in with a TMJ issue or headaches or anything, it's looking at the cranial system as a whole, because there's so many different moving parts. And so I look at the cranial system, look at what Asena was saying, frontal, what's going on, temporal bone, sphenoid. I can get into all of the technical names, but I won't bore any of you guys with that. But again, also looking down into the neck is very related in so many different ways, which we are going to cover, I think, in the next couple of slides, with the different muscles that are attached, the nerves, and even coming into the vertebrae, and then again further down, because once you have an issue in one area, it's just going to cascade all the way down, and next thing you know, the person's actually coming in with ankle issues, and that's a whole different story. But it's, again, osteopathically, we're looking at the whole system. I have had patients who come in with hip pain, and then we travel all the way up to the head, and there's a jaw thing going on and things like that. So it's quite the journey when you come in to see an osteo.
So Claire, from what I'm hearing, and I'm also hearing from Asena, that there's no clear-cut answer for TMJ issue. It's going to be basically what a lot of other things happen. It depends.
Yeah, for sure. I mean, the body works as one functional unit. That's what we need to keep remembering, is that everything in our body is connected head to toe. You know, I always joke with my patients. A lot of patients come in and say they have neck pain and back pain, but they're not related. And, you know, I'd have to really question that, because if I have a headache, my whole body is responding to something going on in my system, right? I don't leave my head at work and take my body home and go to bed, right? Like, my whole body travels with me. So it's all happening all at once.
Yeah, I think, Clara, you had a TMJ client, but even before you treated that particular client, their jaw, you actually worked on the rest of their body first before you actually went to treat their head.
Yeah, it really all depends on what the primary root problem is, not necessarily what you're coming in with. You could be coming in with jaw pain, but that could actually have just been the straw that broke the camel's back. But we got to figure out what was the first thing that created this cascade of issues. And so for some patients, it is looking at the rest of the body first and trying to realign that so that the jaw can then it just makes it easier to fix the jaw as well, right? So if we were to just work on the jaw, but the rest of the body isn't looked at, then you can feel great for temporarily, but once you walk out, or you sit in that same position again, your body's going to pull that jaw out of place and you're going to start to feel that pain again.
Yeah, well, I have firsthand experience about how important, the whole body's acting together in concert, because I remember I was having this neck pain, and Victor, our massage therapist, was giving a massage on my hips. And by the time I finished that massage, my neck problem had basically disappeared. And that just gave me an appreciation for the whole body.
Yeah.
Okay, that was great. Thank you very much for that overview here. Before we go to some of our audience questions that they have posed before the start of the webinar, I want to throw up our second poll there. And the second poll here is just to get a sense here. Please vote right now. What have you tried in the past to deal with your TMJ issues? Give you a few moments here to see what's popping up here.
You can only choose one. I've tried all.
Yeah. Again, as you said, the question depends. So if your answer is not here, please put in your chat, what have you tried? And we love to see what's going on there.
I mean, honestly, it should be more than one answer, Darryl, because it is like exactly all of the above. Because it is, again, it's a system, and everything is gonna help each other, and it is multidisciplinary problem in my point of view. If the patient is going through like a lot of stress, depression, anxiety, if I put an occlusal splint there, the patient is gonna continue to like grind and clench and do all the stuff to, create that TMJ problems. Look, patient says taking pain medications twice a day. Yes, there is like non-steroidal anti-inflammatories like Advil. It is helping a lot, but at the end of the day, it is not treating the main cause of it.
Yeah. Looks like right now the answer here, Asena, you're the most popular here, dentist. So 47% have seen a dentist. And then osteopathy, a few people have actually picked up on that, and some massage. So it's all over the board. Yes, the limitations of Zoom, I wasn't necessarily inventive enough to figure out how to have all the answers or multiple check boxes. So next time I'll figure that out.
There's some people in the chat who are also mentioning that they've done chiropractic work, homeopathy, neuromuscular dentist. Interesting.
Neuromuscular dentist.
And NUCA specifically, I'm not quite familiar with what that is.
It's I've had it before. No, it's chiropractic, but they actually kind of just deal with the upper part of the neck here. And so again, it's a very subtle, something similar to osteopathy, but some people seem to have some good success with that one.
Cool.
Good. Okay, so stop sharing the results. Let's go on to our Next question here, and this is an audience question here. So our first
Mhm.
audience, just before we go in, I forgot, we might not necessarily, just because of the time constraints, we might not get to all your questions. If we do not, we are going to personally reach out to you and we're going to answer that and we'll follow up. One thing is that Clara is offering here during the lockdown, we can set up a virtual conversation for a 15-minute consultation. And she can answer some of your questions there. Okay, so the first question here, who wants to take this one? Any tips to help not clench my jaw when I'm stressed? I don't notice I'm doing it until it hurts. This is talking about the awareness you were talking about.
Awareness, absolutely awareness. If you don't have any bite guard, occlusal knife guard, whatever you want to call, it's the same thing. Just awareness and breathing techniques is amazing. And if it only happens when you're stressed, like now, if you're asking this question, that means that you're aware of it. And it's all about teaching your brain how to, like, okay, I shouldn't do that. It is not going to happen. It is not going to happen over the night. But you can slowly try to teach your brain again, like relaxing it. But at the end of the day, I highly recommend the occlusal splinting.
Nice. We just had Iris. She's a retired physio, but she said putting your tongue on the top of your roof of your mouth doesn't allow you to clench. Okay. And we have another question here from Catherine. Could the salivary glands be involved?
It depends. It can be, it cannot be. If you're just looking at the TMJ, the joint itself, salivary glands, we don't have any salivary gland in the joint. But tight muscles, because salivary glands are located inside the muscles and tight muscles can affect the salivary gland, we have to take a look at it. Like once you ask about salivary gland, what is the question related to that? Are you having any like pain while you're eating, around the salivary gland? We should check.
Okay. There is a question that was posed before here, the Trigeminal Neuralgia. Alexis, we just want to let you know, it's a little bit more complex issue. We're going to take that offline and we're going to reach out to you to discuss that a little bit more in detail. So you're going to get some personalized attention on that one. Because
it is not related to TMJ problem, and we would like to take a look at it in another way.
Super. Okay, so you're already chatting with her, Clara. Thank you. Let's move on to the next question. And our next.
Hold on, Colleen mentioned that when her jaw pain is high, the saliva response hurts a lot, and that's probably because of what Asena was saying with the tight muscles associated with the joint. So it's not the joint itself, but because you're clenching, because of where the gland sits, you're constantly activating it. And so that's why it's important. Then we do have something at the end. I think Daryl's going to be sending out a little bit about a self-massage on how to relax some of those muscles, and maybe some stretches. But Colleen, feel free to reach out and I can definitely show you some stretches over Zoom that might be able to help you out as well.
And if saliva response hurts a lot, and if you feel any swelling, we should take a look with the x-ray too, if there is anything going on with the salivary gland too.
Nice. Yeah, that self-massage, Victor wasn't able to make it today to give his perspective from a massage therapist and what you can do at home. But he recorded a video and we'll release that in the next few days so you guys can take a look at that and practice some of this kind of relaxing the muscles at home. Mm-hmm. The next question here, how does jaw pain radiate around areas of the head or face? How to identify if jaw or neck, etc. They had a concussion 9 years ago.
So head and neck, face area, everything is connected. And as you can see, all the muscles are connected too. And once you have one problem, like you have on your shoulder, for example, or your back or lower back, they can radiate to the other areas of your face. Also, the nerves are connected too. So we see a lot of radiating pain in some other areas once we are having a TMJ problem or the muscle problem, muscle pain.
Yeah, it basically is just all of how it's connected. So if you want to, I think one of the questions was, how do you know if it's jaw or neck? And it's really, you're now asking what came first, the chicken or the egg? And realistically, why not just treat everything? And instead of just, if we can focus in on that, sometimes it's just, we treat it all, get rid of the pain, and that's that. You don't even have to worry what came first. Was there something about, you had a concussion a few years back, and
Yes.
that could definitely have jarred a lot of the structures to have created that. And it might not have been, you might not have noticed that your jaw was associated with that at the time, but just the movement of any kind of concussion, it's a little bit more of a whiplash. And so everything does get affected. But yeah, we have a lot of, like you can see here with all the muscles that are associated within the jaw, going into the neck, going into the collarbone, how that's just going to create a lot of tightness. And now let's say you have more jaw pain on one side than the other, how that's going to tighten up one side and not the other. And you end up with, a crick neck. And then all of a sudden you come in with neck pain, but it actually comes from your jaw because you're clenching on the one side. So it could be that, or it could be vice versa. Maybe you sit at your desk and you always tilt your head to one side and you don't even realize it. And now all of a sudden you just have so much more tension on the one side of the jaw. And now you come in with jaw pain. So it's we don't really know what comes first.
And I see a message there saying, I see a message here saying that I never realized TMJ not related to trigeminal neuralgia. Okay. Quickly, I want to talk about trigeminal neuralgia. It is a very complicated subject, and it is usually a subject for neurologists, and it is a nerve problem. And trigeminal neuralgia, it is a nerve, trigeminal, it is connected to upper jaw, lower jaw, and facial nerve. And so on TMJ and neuralgia, if you have the neuralgia, maybe you're clenching because of the discomfort, but TMJ issue, I think it is a subject that we shouldn't put together. So, yeah.
Okay. Yeah. Well, we'll have a separate conversation on that one. And then Catherine is reporting here, I had a stone come out of the salivary gland once. Okay.
Yeah, that happens.
Really?
That happens.
What causes
Like a kidney
that?
stone or something?
Somebody's sometimes secreting more denser saliva, more like calcified, and we see some salivary gland stones in the saliva, and it is we see that not so common, but that happens. And it is causing discomfort of the salivary gland. So that's why if a patient is suffering from saliva problem, especially right before while you're eating, we should check any stone formation in the salivary gland.
Sounds like that might be nutrition related too.
Can be, yeah.
Okay. Let's move on to our final poll. We're talking about chewing gum here. Someone was posing the question here. And
That's me, sorry.
The final chewing gum is chewing gum bad for you? What's your quick initial thoughts on that?
Chewing gum. Oh.
Hold on.
Well, don't answer it quite yet. Well, let's our participants.
I mean, yes or no, and both. All of the above.
Oh, it's a tight election here. Oh no, it looks like mostly no. So 63%, 10 people said no. Chewing gum is bad for you versus 7 people.
I mean, people just thinking it's a trick question, so they
yeah.
That's why we brought it up today.
Someone said both. So who wants to take this one?
Chewing gum is not good for you. It is not recommended. I personally wouldn't even say that chewing gum could potentially be good. I got out of the habit of chewing gum. Basically, what it does is it overworks your muscles. And so, I mean, you're not going to do 10,000 bicep curls a day. So that's just going to tire out your biceps. So the muscles that you're using to chew this gum are also much smaller than your biceps. Your biceps can actually take quite a bit of load. So the muscles in your jaw are really much smaller. They can't take that much load. And that could definitely be overcompensating. So yes and no to switching sides, but really what you should do is just stop chewing gum altogether and try to find something else, a mint to suck on or something.
Are you not torn between this? I thought chewing gum would help manage plaque and all that stuff, and I don't know.
I won't prescribe gum to control the plaque or something. Brush your teeth if that's the problem. But personally, I love chewing gum, like a lot. And because of that, I have these cheeks. And like Clara said, I work them a lot. And but if you're having a TMJ problem, pain on your muscles, headaches, we don't recommend chewing gum because, again, like Clara said, it is overworking your muscles. And on top of chewing gum, also we don't recommend chewing very hard food, like for example beef jerky. It is so hard to work through. It is again bad for your like muscles and joint. If you're having a problem, if you don't, go for it. And big bites, big biting into apple, like a very big bite, it is also not very good. And it's all about like leaving them alone a little bit, like being gentle. But chewing gum, yes and no.
It's one of those, chewing gum, I also associate with that. The overworking the muscles is a tough one. I know I see a lot of teachers, for example, a lot of teacher clients also come in and they also have a lot of TMJ issues, and it's not from chewing gum, but it's from, they're talking for 7.5 hours a day, right? So that's also overworking your muscles in a different way, and it can create that stress and that tension within the head and in the neck. So it's not just chewing gum, but if you can help it, try not to do it. So if you can get out of that habit, that would be better for you.
Sounds like teachers and professors, massage therapy might be a good thing to help relax those muscles then.
Yeah, for sure.
Okay. We have a message here from Anonymous saying that, is it possible to do some stretch examples for everyone to see? What we're going to do is, again, we're going to send out a video that the massage therapist has sent out, and we also will create a handout about some stretches that we got from Iris, the retired physiotherapist. So thank you very much for that. Lots of information that's going to come out afterwards after this webinar.
And I see another message saying insurance plan rule out payments for TMJ treatments. Why? Because they don't think it is treatable. All right, depends on the treatment itself. Night guards, for example, of those splints, most of the insurance plans are covering it, most of them. But to see what they're not covering they're not covering implant too, but that not necessarily they think that it is not something like a reliable treatment. So I would like to say not necessarily for that question.
Okay.
They don't cover sometimes crowns, sometimes some surgeries. Insurance doesn't cover means that it is not reliable or it's not treatable.
Is TMJ was too general issue? That's why it's not covered?
Depends on what they're not covering.
Okay.
But like I said, most of the insurance is not covering implant. They're not covering crowns. They're not covering bridges. So it is not related that it is treatable or not treatable.
Okay.
Okay.
Next question here is, let's try to move this along. Is there a known genetic factor involved on having TMJ issues? I see that my little kids are also clenching at night.
Oh, yeah, that we see. with the kids, it is not necessarily means that there is a big problem. Again, like I said in the first place, that science doesn't know exactly why is it happening, especially with the small kids. Once they're having, while they're having their baby teeth, they're clenching. So it can be some habitual. It's okay. Most likely it is going to go away, but we should take a look if they're having an earache, ear infection, or they're shedding teeth, or it is like they're having an infection on their teeth. Maybe that's why they're like clenching to get over with the pain. It's like some form of showing trying to help it. And maybe they're going through stressful times in the school, or they're like generally like stressed about some stuff. We should be, again, aware of what's going on in their life. For example, once the child is overstressed, maybe we can help them with the relaxation, how they can cope with the stress, like helping them to breathe, sit down a little bit, breathe, and calming themselves down. And once you see them while they're sleeping, if they're clenching, you can approach them silently, maybe just calm them down while they're sleeping, or maybe change the position of the sleep. So it can help with that clenching at that moment. And if the problem is so much, of course, we should take a look at if there's any misalignment on the teeth, or if there's any problem going on. And we can, again, offer splinting to protect the teeth.
So to clarify that question, Joanne had mentioned that her mom had a clicking jaw and now she has a clicking jaw. She was just wondering, was it inevitable that she was going to have a clicking jaw? So I think, Asena, we talked about this earlier about the misalignment, and that could be a genetic thing. Definitely, it's something that's more misaligned in your structure itself, as opposed to being something more stress related. But without really seeing your mother or yourself,
Yes,
we don't really know that. But that could be one factor for sure.
Yeah.
But a clicking jaw is also something that can be very treatable. Just trying to work some realignment within the body itself, within your own body, and trying to get rid of that, because I can see how that could be pretty frustrating.
And Joanne, are you using night guards? And if you're using, is it helping?
And while we wait for that answer, there's another question. Any relation between TMJ issues and tinnitus? Well, tinnitus is one of those very, very tough ones. Yes and no. Because of how closely related the ear is to the jaw itself.
That's ringing in the ear, right?
Yeah, sorry. Tinnitus is ringing or buzzing in the ear. And so a lot of people do come in with tinnitus, and I do look at the whole TMJ mechanism as a whole anyways. So it is possible, but tinnitus itself is, nobody can actually tell us where tinnitus comes from. There's so many different reasons for it, but we would have to explore a little further.
It can be. We do see, like maybe not exactly tinnitus, but it can be like ache, very thin ache on the ear. Like I see that, and then I see it on myself too. Okay. And then I also see another question: is Botox in the jaw actually used to treat TMJ pain? It is not a pain management, but yes, we use Botox to treat TMJ problems related to the muscle. So let me super quickly explain what Botox does. It is reducing the stress on the muscle. It is reducing the strength of all the muscles, actually. You cannot clench as much. And if you can balancedly treat both sides and the other areas of the whole system, your body, your brain is not gonna able to clench. And usually Botox treatment, the treatment length, like it's wear off like around 6 months. So you need to get like twice a year. We can just generalize it. And if some researchers say that if you get it like constantly, let's say that 3 years, your brain learns not to clench. So because it cannot, right? And the most important thing is the balance on the right and left. Let's say that you're clenching on the right side and we treat the right side with Botox, and then your brain is going to be like, okay, I cannot clench on this side, so I have the left side. Let's work on it. And the patient comes in 2 months and then having a problem on the left side. But before jumping into Botox, I will recommend to try other areas. Again, first of all, if you don't wear night guard, in the dental perspective, we can try that. And also like relaxing the muscles, correcting the posture, seeing other areas is so important. And if it's still not helping, for example, night guard, if your muscles are still super tight, you're still working on it, you're still clenching, then Botox is a really good addition to the treatment. But that doesn't mean that we can throw everything in the garbage and then just rely on that.
Okay, thank you very much, Sana. Good answer. This one, do we answer this question? How to speak to how a jaw can become misaligned and the cause of these symptoms, as well as how to deal with this?
I touched on it a little bit with posture. That's definitely one potential reason as to what can cause a misalignment. Like I said earlier, everything in our body is still moving. Nothing is actually solidly set in our body. And so if you are sitting, you're sitting more often, and you're not getting up and you're not moving as much and you become more sedentary, if you got a forward head posture, because you're reaching out to look at your screen or look at your phone or trying to watch TV, something like that, that's going to create a lot of changes in your whole system that can create some misalignment as well. Osteopathically, that's how I see it.
So misalignment of jaw, usually with a trauma, it can happen. Like if you think about like you are born with perfectly normal jaw alignment, everything is good. And if it's misaligned and over the course of years, that means that there's something going on, like a trauma or a misalignment of the teeth. But usually what we see is like once you're born with it, like your teeth are misaligned or something going on, or you're applying so much tension to your joints and it is causing degeneration in the joint and joint socket and the disc. It is a very like big system over there, and we just need to examine and individually see.
Just to add to that, you touched upon birthing and stuff, and so one of the questions that I always ask as well is, do you know your birth story? Babies who come out forceps, suction, or anything like that, that's putting a lot of pressure at the top of your head because they're sucking you out, and that's going to change a lot of the structures that come down into the jaw, and that right away can create some issues. And this kind of ties back into, you see it in your children, so also something to think about. It could be that it was a genetic thing structurally, but if your child also came out in a situation like that, that could have also created a change in the jaw itself and structures within the face.
Yeah, and it sounds like here after our conversation, some of the easiest things to do is to work on your posture, stop putting your head forward and bringing it back. And it sounds like from Iris to put your tongue top of your mouth to stop from clenching too. So, and having that awareness, some easy things that are ready to work on. Okay, what's this one? This one, what?
Yeah.
Have they had success with for Bruxism? What's that?
Bruxism. Bruxism is grinding your teeth, and success with the treatment for bruxism. And bruxism, again, it can be a result of stress, or it can be habitual, or like maybe your teeth are not aligned very well, so you like doing that, and it can be a result of a medication too. We should take a look at your history. Treatment for bruxism, what we do mostly give, again, a night guard First, to protect your teeth from Bruxism effect, which is like flattening the teeth that I talked about, and then chipping off the enamel. Also, with the night guard, we are giving like more balanced occlusion. And what this occlusion means is like both upper jaw and the lower jaw touching together and applying pressure in between. So with that guard, we are balancing those loads coming to your teeth, and you're not gonna able to clench or grind your teeth as you were used to be. But again, to see what's going on in the source of it. Why are you doing it? Is it stress related? It is misalignment, anything else?
Osteopathically, what I do with people who clench and grind is, like I said, looking at the whole system. But one of the things that really separates from an actual clenching and grinding is I actually treat patients with their night guards in as well. Yes. Because one thing, like I was saying, is I always look for where there's a lack of movement, and with a night guard in, it actually does stop that movement. So we want to make sure that at night or during the day or whenever you're wearing your guard, that your whole system is still working in sync with the mouth guard. And it could be an upper, it could be a lower, it could be both. So I do treatments for both, just to make sure that your system is still working as a whole. But again, yeah, that's all I have to say.
I remember you also telling me when when the dentist makes an adjustment to the night guard, you ask them to come back and see you, Clara, because sometimes the night guard makes a change there that you might have to take a look at.
Yeah, and this is where, Asad and I can work very, very closely with each other, right? She makes the night guard, I make sure that the system's working, and then you have to go back to see her to make sure that the night guard is still
helping.
It's still effective, right? And so we kind of go back and forth until we can both come to a good agreement. And I mean, for her, she wants to make sure that she's protecting your teeth, and obviously making sure that you're still breathing at night, making sure that it's not occluding anything. I remember having that joke with one of the dentists that I'm working with, and he was like, yeah, I just want to make sure that they're breathing at night, but you have to make sure that everything else is working. I'm like, okay, fair enough. So this is why working with a dentist is very important, especially with a case like this.
Yeah. I think this is what we want to also bring up with the Asena and Clara at Satori and Momentum. When you guys work with us, the communication is going to be flowing. And one thing I appreciate is, as health practitioners, we're trying to see the playing field as much as possible. It's not just dentistry, not just osteopathy. There are different types of services that could be helping, and we're going to make those suggestions when that's warranted.
It's a big system. It is like everything is working together, and in order to fix that, we should work together too with our patients in between each other, and it is very important.
Iris also said physiotherapy too. Yes, Iris, definitely physiotherapy can help with the TMJ.
I just want to quickly address, maybe not so quick, Edward,
I want to come to that
in the chat there. First off, I am a little bit shocked and very sorry that you had to go through all of that.
I'm so sorry too. Yeah.
The trauma to the joint, and you don't have any violence associated with it. Our body locks in a lot of trauma, emotional trauma, and so working and releasing all of that can really help with your jaw pain as well. It might not be, and this can be anywhere in the body. I know this is a TMJ specific webinar, but this could be anywhere in the body. Is any kind of trauma that you've been through emotionally, your body stores somewhere unless you've worked to treat it. And it sounds like for you've stored it in your jaw itself. And so that's something that osteopathically we can work on. We can definitely take a look to see, because if it's stored there, then your whole body responds to it, and it kind of just clamps, and it crystallizes, and it just, I don't, crystallizes is the wrong word, but it just stores that memory there. And so we need to work to unwind all of that. Because like you said, through the years, other issues have compounded on that. And that's what we want to kind of try to unwind and try to get rid of. So again, I'm sorry that you went through that.
Exactly. Yeah. And orthodontic treatment, I would like to talk about just a little bit. We were talking about misalignment of the teeth, What is that and how we treat that? We treat that orthodontically. So I don't know how you've been treated, well, how was your teeth are, how they are right now, but we should absolutely check the occlusion, the contacts of your upper jaw and lower jaw, how they are end up being, right? And if they're treated right. And to see if they're adding more stress on your joint and more stress on your teeth, particularly one side, let's say that one side is touching each other more than the other side. So if you're going through an experience like that and you see other patients been through the same issues, it's not a bad idea to recheck, like being examined again about your teeth and to make sure that everything is okay.
Thank you. Before we move to our next question, I'm going to go and jump to our drawing for the massage. So, thank you so much for coming on to the webinar. We just got a couple more questions left, and then we'll close it up. But type in the word TMJ into the chat if you're interested in getting a 30-minute massage with Victor, who kind of can take a look at your TMJ issues. And we'll have a draw at the end of today's webinar and figure out who the lucky winner is. So go ahead and type TMJ into the chat.
Can I participate? I'm just joking.
Yes, Claire. Anyway, don't worry. We'll talk about that one. Thanks. You're part of the lockdown. You gotta stay home.
Yeah.
Let's move on to our next question here. One of my ears has been popping frequently from seemingly no environmental changes. So what may be the cause and how to fix it? Anything that comes to mind, Clara?
Well, misalignment would be the biggest one. There's something that is occluding something in the ear, and we talked about how closely related the joint is to the ear, of course. And so there's something going on with a misbalance on both sides. And so definitely taking a look at that, and not even just the joint itself, but taking a look at everything else that's associated with it. There's lots of stuff that is a little bit deeper in the cranium that could be affecting that as well, and stuff that's within the mouth itself that could be creating some of that misalignment. So I would definitely need to get my hands on to see where that misalignment is, and to see is it even coming from the cranium. I mean, it could be coming from your neck because you're doing a head tilt kind of thing. So that may be the cause. Let's put it that way. That would be my initial reaction, would just figure out what's going on there.
My approach will be like understanding if it's really, like Clara said, if it's really coming from your ears or is it coming from the joint? And when do you hear that popping sound? While you're opening your mouth, while you're closing your mouth, or like while you're turning your neck. So it is so important to understand. And since the beginning, like we said, everything is individual, and this kind of complicated issue, TMJ is a complicated issue because it's a joint. We need to see everybody in person.
One of the last questions that we have for today here: how effective are mouth guards for preventing teeth grinding? I say good, yes.
Hold on, sorry.
I think mouth guards.
I know the mouth guard that I wear definitely prevents my teeth. So my story is that I have caps on my teeth, and I, in university, like a stupid teen, decided not to wear it because it wasn't cool. And I actually grinded off one of my caps and then needed an emergency root canal. So that wasn't fun. So now I wear my mouth guard religiously. And I haven't had that issue. I haven't had a root canal since. So
it is quite effective for preventing the grinding and clenching, and it is helping to again balance the forces biting forces evenly distribute all around your teeth, not just focusing on the only connecting areas. And it is also relaxing the joint and the socket and everything. But again, it is not just the exact treatment of it. Like, we need to take a look at other sources of the problem.
Super. Alexa, no, Alexis has I think she has a question. She's putting her hand up. So if you wanted to type in a question, by all means, Alexis. The winner for the massage is Katie. So well done. We'll talk about that offline, and we'll get you set up for that. What else do we have? So Jacinta said, bite guard puts something between the teeth so they aren't touching. Yes.
Yeah.
There's also one in the Q&A.
Yeah, I'm reading that one too.
I know that this is going to be not what you want to hear, but we really do need to see you and know a little bit more about your health history before I can figure out what's going on and why you've been experiencing pain for the last 7+ years. It does sound like you've seen a number of people, and I'm not sure who you've seen or what kind of approach you've taken. So if you don't mind emailing us, just getting in contact with us. And again, I am doing the free 15-minute consultation. So I'm more than happy to speak to you about that, to try to figure out what's going on and who to send you to. Oh, I'm choking on my own saliva because that's what I do. I'm like pro at that. I'm really good at that. So
yeah.
Anyways, please feel free to reach out and let's talk about that a little bit further, but a little bit difficult to answer that question on how many treatments, how much it's going to be, and what kind of path you should be taking.
Okay.
Unfortunately, specialist fees are way more higher than dental, like regular general dentist fees. That's the truth. And that's why once we see if the problem is deeper and more complicated, we refer our patients to specialists. And again, like Clara said, it is important to see the history, what happened, what you've been through, what treatment has been done, where are we, and if there is any other problems. So hopefully we can help you.
Yeah. Let's finish this off with Alexis. She's asking here, I heard the mouth guard doesn't actually help. So with the pressure of clenching, I was told it's better for grinding. Is that true?
So better for grinding, better for clenching. It is grinding, it is helping the mouth guard. It is helping to protect your teeth from getting cracks. But the clenching pressure, it is going to be still there, because the mouth guard, it is not going to stop your muscles to clench, stop your muscles to work. But it is applying, like I said, like it is just even it distributes the whole load of clenching, and it is helping not to focus on one areas that teeth are touching each other. And eventually it is helping for you reducing the clenching habit, because you're not gonna able to clench so well, because there is a block in between. You're not gonna able to lock your teeth together. But yeah, pressure is not going away. You're still clenching, but it is helping. But the guarding wise, it is guarding your teeth from chipping off.
Okay, super. Well, guys, we ran over our time, so I just wanted to close it up and thank you so much for attending today. I got a better sense that Tmj issues a huge area of concern. Looks like a few people are living with pain on this, and it needs to get dealt with. So if you would need to reach out to us, we have an email address, healing@satoriwellness.com. We'll be following up after this webinar, and we'll be sending out some handouts and a phone call just to check to see how everything is. In the chat, Kobe has typed in our email address, and we'll send out the question to either the dentist or to the osteopath to get it answered But yeah, please don't wait. If you have a concern, shoot out the question. We'll try to answer it as much as possible. And our next webinar is going to be happening in the middle of February. We're going back to massage therapy. Victor and Sarah are going to be chatting more about those things. And I think we'll spend a little bit of time about actually how to do some self-massage of the jaw. But again, thank you very much, Clara and Asena. Thank you so much for bringing your expertise there. Kobe in the background, she's been a great managing the pools and managing the chats. And I wish you guys a safe day today. Hopefully you guys get out and get some fresh air. It looks like a wonderful day. Okay,
Thanks for coming.
today.
Thank you. Thank you, everybody.
Bye.